This might seem like a very simple topic, but I think it's worth for us to quickly discuss what the goal of the patient encounter is, and also to start to appreciate how easy it is to compromise this goal and lose sight of it in our day to day. So, as we think about a patient that's presented in really any clinical setting, we can think about the fact that there is a reason for the encounter. Is this the first time we're seeing the patient and they have pain? Is this a patient who just had surgery, so the reason they're here is that they're recovering in post op? No matter what, there is a reason why the patient finds themselves in a clinical scenario, and we have to be sure that we're cognizant of why they are here. Similarly, once we identify the reason they're here, we can start to think about what the future directions are for that patient. Is it us solving what's the cause of their abdominal pain? Is it us making sure they recover as quickly as possible and getting home safely? It's tailored, our future directions are tailored to the reason for the encounter, and we need to be cognizant of both. So essentially, the goal of the patient encounter is to understand why the encounter is occurring and then find a good route with regards to the future of the patient. Really preserving all of the things that we've kind of discussed before, their best interests in our treatment and care plan. Sounds simple enough, right? In reality, we find ourselves sometimes overwhelmed by details because the reason for the encounter may be complicated. The future directions, the treatment for some certain things may be very, very complicated. So the more degrees of separation we have between kind of these fundamental principles, the more and more we find ourselves at risk of losing sight of the bigger picture. A great example is, and this is a true story, where in your training, you may have senior physicians and senior medical professionals start to ask you questions that gauge your understanding of concepts. And sometimes you may find yourself in a position where, quite literally, you're being asked, what is a better insulator for a patient, saran wrap or foil? Is it more useful to wrap a patient in saran wrap to keep them warm or to wrap them in foil to keep them warm? And this may sound very bizarre, but this happens all the time in different clinical scenarios. And we have to take a step back and think about why. Why are we discussing this? It's not to say that there can't be some connection to the patient with this saran wrap foil discussion, but fundamentally, does that discussion really get at the reason for why they're in the encounter, or does it really have anything to do with our future directions? Is our discussion about foil and saran wrap kind of low priority or low yield, if you will, and more of a distraction? I would say yes. There may be exceptions to that rule, but fundamentally, we have to appreciate how easy it is for us to get off track. And I believe that all of us, even when we're trainees, need to do our part in trying to make sure we bring back the conversation on the important aspects and make sure that we don't miss something important when we're arguing about different types of food wraps.